So Sayward, you have the floor.
Thanks, Joanne. Hello, everyone, and welcome. My name is Sayward Montague, and I'll be your host for this afternoon's live webinar with Colleen Flood, Director of the University of Ottawa's Centre for Health Law, Policy and Ethics. I'm joining you today from Ottawa, Ontario. My home and the location of Federal Retirees National Office are on unceded, unsurrendered territory of the Anishinaabe Algonquin Nation, whose presence here reaches back to time immemorial. Because this meeting, like most right now, is being held virtually, a singular land acknowledgement neither honors all of the people and nations who cared for this land before us, nor does it capture the richness of our distribution across Canada. I encourage each of you to take a moment to acknowledge the land from which you're joining today's webinar and to reflect on how we can each move forward in reconciliation and collaboration. Since our beginnings in Victoria, BC in 1963, federal retirees have advocated to protect our members' earned pensions and benefits and to improve the lives of all Canadians in retirement. Our nonpartisan advocacy work supports secure, healthy, and dignified retirements for federal retirees and all Canadians. The ability to age in place with dignity and security should not depend on your postal code. But as we've seen during the COVID-19 pandemic, that is increasingly the case, particularly when it comes to long-term care. Thanks to everyone who's joining us this afternoon, and especially to Colleen Flood, who will help us unpack and understand some of the dynamics involved in setting up national standards for long-term care in Canada, and help us understand that a better framework and better long-term care are both possible. Colleen is a professor at the University of Ottawa and a university research chair in health law and policy. She's also the inaugural director of the University of Ottawa's Centre for Health Law, Policy and Ethics. From 2000 to 2015, Colleen was at the University of Toronto's law faculty with cross appointments with the School of Public Policy and the Institute of Health Policy, Management and Evaluation. Between 2006 and 2011, she served as scientific director with the Canadian Institute for Health Services and Policy Research, or CIHR. Colleen's main areas of scholarship are comparative healthcare law and policy, public and private financing of healthcare systems, healthcare reform, constitutional and administrative law, and accountability and governance issues more generally. And she's joining us today all the way from New Zealand. Thanks for joining us today, Colleen. Before we get started, we have a few more instructions from Joanne to help you make the most of our webinar. So Joanne, if you could walk us through these.
Yes, Sayward, thank you. Let me just share my screen and we'll begin. So first note that this webinar is being recorded and will be emailed to everyone who registered for this town hall probably next week, as we are Thursday. While we share these screenshots, you'll notice the speaker's video box as well. If the box hides some of the images we are sharing, simply minimize it by clicking the line in the top left corner or move it by dragging it with your mouse elsewhere on your screen. To enter or exit full screen viewing on your device, click the button labeled Enter or Exit Full Screen, or the diagonal arrow, depending on your device, located at the top right-hand corner of the Zoom window. All attendees are in view mode only, which means you'll only be able to see the presenters. If you would like to ask a question during this webinar, click the Q&A button at the bottom of your screen to open the Q&A window. From the Q&A window, you may type your question in the box and click the Send button to submit your question. Note that all questions that we will answer during the webinar will appear above the question box. We'll be answering questions at the end of our presentation, but please type them as you think of them. I would also like to point out that you can vote on questions that have been submitted by clicking the thumbs up icon. This will help our team understand what you most want to know about from our panelists today. If you see a question you'd like to have answered, simply click the thumbs up icon. The chat option at the bottom of your screen is unavailable except to copy and paste the link to the French slides. So please be sure to use the Q&A feature to submit your question. Should you need to leave the webinar at any time, simply click the red leave button at the bottom right corner. Sayward, back to you.
Thanks, Joanne. So we'll get started. Colleen will lead us through an overview of long-term care in Canada, including some of the root causes that has really put Canada's long-term care system where it is today and where we might go from here. As Joanne mentioned, we'll also have some time to have a conversation with Colleen and ask her some of your questions. We have some queued up already that folks have sent in ahead of time, but don't forget to ask your questions in the Q&A feature and vote with a thumbs up for questions you'd like to see answered. So Colleen, over to you.
Okay, so I'll just share my screen and let's hope that this works. And okay, so Sayward, are you good? You can see that fine? Okay, wonderful.
It looks great.
Okay, so thanks so much. First to Jessica for inviting me to speak with you today and for helping to organize this, and to Joanne for the terrific Zoom instructions. I've never seen that done so well, and to Sayward for being my interrogator today. I'm going to talk to you about national standards in long-term care, starting with a bit of background. As most of you know, a lot of, or most of the COVID carnage in Canada has been located in long-term care settings. And we have the unfortunate distinction of really leading the world in terms of the proportion of our deaths so far, and I hate to have to add the so far part, having been sourced in long-term care settings. And I think we've all been horrified by the accounts we have seen from families, from residents and staff, from the military, too, of the horrendous circumstances in which thousands of seniors have been forced to live and far too often to die. So why has this happened? And there are a range of reasons why we have seen so much carnage in long-term care homes as a result of COVID. And I won't go into them ad nauseum, but you know, some of the most important things have been movement of long-term care staff from facility to facility because they work on contracts, no guaranteed sick leave. So even if they're feeling unwell, they're coming back into the facility and potentially infecting residents with COVID. Failure to provide staff with adequate PPE. In some situations early on where long-term care residents with COVID were being shipped back from hospitals to long-term care settings. So a range of things that happened that really spurred the carnage that we have seen. So why is this though? You know, we can sort of point to these things: lack of PPE, lack of infection control, lack of appropriate clinically trained staff, but why? Why have these things happened? And as far as I can see, this is sort of a perfect storm of a lack of political accountability for what happens in long-term care settings, private delivery, and weak regulatory oversight. So this is what I'm going to really focus on here today. And I'll just give you an example of this. A few years ago, there was a spate of awful stories about things happening in retirement homes in Ontario, and regulation was promulgated by the Ontario Liberal government of the day to regulate retirement homes. But if you look at that regulator is basically by law required to be essentially dominated by the industry itself. So the regulator is really the industry, and we've had now Auditor General concerns about the state of affairs with retirement homes in Ontario. And I don't really think it's too much of a surprise why that is the case. So then you have to sort of step back and say, so why do we let that happen? Why is this perfect storm of a lack of political accountability and private delivery and weak regulatory oversight? What's going on behind that? And there, I think we have larger problems relating to how we view the elderly, how much value we put on the elderly, how much value we put on women in particular, because a lot of older women are present in long-term care settings, on disability, how we respond to particularly mental disability, people with cognitive issues, dementia and Alzheimer's, and physical disabilities. So there's a lot of prejudices, if you want, that kind of all come together around how we think about people in long-term care settings. And I think most likely that explains really why we as a society have let this situation come to pass. And going forward, there's a lot of talk now about we've got to improve things, we've got to put more money in, etc. Even before the pandemic, though, most people, I think, were very fearful of having to be admitted to a long-term care setting. Now I think people are probably terrified, but even before, no one really wanted to go there. And we've had report after report after report saying we need to do something, improve long-term care. Nothing has happened. And the reality is that where we are in the world relative to other countries, Canada spends less as a percentage of gross domestic product on long-term care than the OECD average. So we're already quite low in what we spend. But going forward, some of my colleagues at the National Institute on Aging have projected that without doing anything to improve the quality of care or improve accessibility right now, that the costs of long-term care are going to triple within the next 30 years. That this is a huge policy challenge for us then, even just to maintain the status quo, which I think we all agree is not good enough. We are going to have significant new investments to even maintain the level of coverage that we do. And this, in turn, what provincial governments are doing, there's a lot of focus on the need for, shifting from formal long-term care to really informal home care. So expecting families and friends and communities to kind of pick up the slack here and provide care to people who are aging in their own homes. But we have to realize that this too is under a huge amount of pressure because of changing demographics and globalization, the way that we work. And so at the same time as we're having this huge increase in need in long-term care, we're going to see 30% fewer unpaid caregivers. That is, people of caregiving age that are able to do this. That's going to be going down. And so this means by 2050 that the average Canadian unpaid caregiver is going to have to increase their efforts by over 40% to keep up with the kind of current levels of unpaid care. And when you think about that, if you know people who are doing this work at the moment, often sandwiched between their parents and their children, this is a really tough thing to be expecting. So, and on the topic of gender, but we talked about how women are more likely to be represented in long-term care settings. They're also more likely to be informal caregivers, to do more volume of work, and that has an impact on their own ability to save for their retirement. As well, women that we see as personal support workers in long-term care settings, that they are disproportionately represented. Women disproportionately represent this workforce. They're often from racialized communities, older women. So this issue of gender is, I think, an important one. And I think it's important to acknowledge the cost of missing work and reducing work hours, leaving paid employment entirely for women to provide the caregiving that an aging population needs. And you see the disparity here between women and men in Canada in terms of lost earnings. Okay, so what does all this mean? That we need three things. We can't just look at formal long-term care. We can't look at the carnage in these long-term care institutions solely. We have to look at three things. We need three things to improve in Canada to ensure that we have appropriate supports for people as they age. So the three things that we need are new investments in long-term care and clear standards, particularly around staffing, but other things as well. And I'll come to that in a minute. So we have to improve formal long-term care. A few of us are going to need it. Not all of us as we age, but a certain percentage of us are going to need 24/7 care, which is always going to be far too difficult for someone to deliver in their home or to provide formal home care in order to do that. So some of us will need this, and these need to be safe and appropriate places for people to live at the end of their lives. The second thing we need is investments in formal home care. So this allows more of us to stay at home for longer or as long as possible, and with a bit of luck to the end of our lives. So with some formal home care services, we have underinvestment in this currently from coast to coast, and we need to do more to help people live at home. And then finally, we need to support informal care providers. So these are women and men who are providing care to usually their aging parents or friends, and they need support to do that. For example, things like training, respite care, time off work so they can come back to work, and so on. Okay. Long story short, the provinces don't have nearly enough money, it seems, to be able to achieve these three goals. And a question for us post-COVID is, what role should the federal government play? And in a nutshell, I will argue that there's clearly a need for new investments in long-term care to achieve these three things. Federal government need to put these dollars in, but the investments must galvanize real change. Because of all the isms that I discussed before, the gender issues, the disability issues, the ageism, there will be a temptation to take money and not really change things, because it would be easier instead to spend our money on a new swanky hospital or paying physicians and nurses more in public Medicare or whatever it is we want to do, rather than investing in care for the elderly because of all those isms that we discussed before, right? So we need to make sure that whatever we do here is meaningful and really galvanizes real change. So what do we need national standards on? So if we're looking at the federal level, what kind of things would we like to see from coast to coast standards on? Now, the first thing to note is that the quality of care for people in long-term care is a difficult thing to measure. It's not like measuring the quality of a pair of shoes or the quality of a new dress or even the quality of a house. The kinds of care that is delivered to frail adults at the end of their lives is something that we can't really be in there and measuring very easily often. And when we have this problem from an economics or policy perspective, normally what we do then is focus on the quality of the inputs, right? And by that, I mean the quality of the staff, the training of the staff, the culture and ethics of the staff. And that's why we spend, bucket loads of time training physicians and nurses, licensing them and regulate and giving them the power to self-regulate so that we can ensure that in that intimate setting between a doctor and a patient, that the doctor will have the right training and culture to provide top quality care to the patient. And you don't need the regulator or the government kind of sitting on top. So the quality of the inputs for long-term care are really important. And we need standards on these from coast to coast that are calibrated to the needs of our different populations and different contexts. So that's a first important thing. The second important thing to note apropos of standards is that we have a lot of for-profit provision of long-term care in some provinces. And generally, we would expect from an economic theory perspective that for-profits will attempt to make profit. It sort of goes with the territory, and that they will do that where they can by cutting things that are non-observable to the outside eye. So that may be, the quality of staff, for example, because, the outside eye might see the lovely sort of entrance foyer to the long-term care home with marble and a fountain and think that's all very nice, and not realize that the workers there might not have the same clinical level of training as perhaps a less salubrious public facility or not-for-profit facility. So we would expect that from an economic perspective, that we would see cuts in non-observable inputs. And I think the evidence tends to support that would happen. And to follow on with that, we have seen that for-profit providers will try to keep their input costs down by keeping their workers on things like part-time contracts so they don't have to pay overheads of sick pay. And we've seen things that happen in the COVID-19 pandemic and the spread of contagion as a result. So this is a very important question, and one that people are really focused on at the moment is, what do we do about for-profit delivery in long-term care? And we certainly need to consider either banning for-profit delivery or phasing it out over time, because obviously you can't go from 0 to 60, or at the very minimum, demanding much better regulation of those for-profit facilities. But I don't want to pick on them too much, because this is a problem not just with for-profit providers. Most of the problem had been seen there, but we still had problems with not-for-profits and public providers as well. So this is an issue around quality of inputs that we need to focus on across the board. Okay, so who should do what then? So, as soon as I start talking about national standards, the refrain we will hear is that healthcare is a matter of provincial jurisdiction, so shut up and go home kind of thing. And that is actually incorrect from a legal perspective. Time and time again, the Supreme Court has noted that healthcare is actually a matter of shared jurisdiction, and it depends on the particular topic, which level of government actually has power. But all that being said, I think, generally regulation of long-term care would probably be interpreted to be a matter primarily of provincial jurisdiction, seen more as a local matter, a matter to be locally regulated by provincial governments. However, the federal government still has the possibility of using this thing right at the bottom on the left-hand side of the screen, the spending power. And so essentially, over time, the courts have found that, look, the feds can use their spending power, they collect our taxes, they get their money, and they can port that money to provinces in exchange for complying with certain conditions and criteria. And this is the most straightforward way for the federal government to hold sway over healthcare. And that is, in fact, how the Canada Health Act works. So that's how public Medicare works. The federal government gives money to the provinces who comply with the criteria set out in the Canada Health Act. So that's how we could ensure standards from coast to coast using the federal power. But as you're probably also aware, some of this hasn't been going so well in recent years. Public Medicare has diminished. There have been runs around to try to privatize it. There are many concerns about quality and access and wait times. So, the model of the Canada Health Act is not an obvious one that we necessarily want to adopt holus bolus, because there are a lot of problems with that. So we need to figure out a way for the federal government to use its spending power and to avoid the problems that we've seen with public Medicare. So the obvious way forward is to use the spending power, But the provinces, they feel they've been a bit burnt by this in the past. They signed on to public Medicare in the 60s and so on, with the idea that it would be a 50-50 contribution. And over time, the federal government's, contribution has declined. And so, here we see the leak coming in. Is that another leak? No, that's the federal government's contribution. So the provinces are not going to be too happy if the feds come to the table and say, look, we've got money here for you, but we want you to comply with certain criteria. And the provinces could well say, well, look, we've heard that one before, buddy, and look what's happened here. So they will need the money that comes to the table from the federal government will need to be ironclad. They need to have guarantees that it will be a long period of time, and there will be no reneging on the deal. So that will be an important part of the governance going forward. And as I said, we need to learn from the problems of the Canada Health Act. And in some, I think the basic problem of the Canada Health Act is that it doesn't require as a criteria that there's accountability for how the dollars are spent, accountability for issues of access and quality. That is missing from the Canada Health Act. And in any new legislation like a Canadian Long-Term Care Act, that needs to be front and center. So this issue of accountability, transparency of what is happening so that we can monitor how things are going for people as they age, and to make sure that they have access to the best care that we can afford. So that's where I kind of get to is, how do you solve that then? That to me is the governance issue, right? We want to get the money from the federal government to the provinces, but not just so they can move the deck chairs around on the Titanic, but so that we can actually improve care for people as they age substantially upon what we have now, right? So to me, the way that this should happen is that the new legislation at the federal level needs to ask each province to have their own arm's length regulator. And that regulator, as part of the deal, must be independent of government and independent of industry, right? Because part of our problem is that the fox is guarding the chicken coop here, and we need to stop that. And this regulator will be required to determine standards for long-term care and for retirement homes. And those standards will include requirements for staffing levels. So how much staffing, given the acuity of patients, the type of staff, models of care, training for different staffing, calibrated to the residents' needs. And it's important that we understand that these things will change, right? As the evidence changes, as we understand more, and we might have different needs in different places. So saying we should just have sort of one standard to rule them all across the country, that you would just write in the new legislation at the federal level, that won't work, right? So you have to have flexibility. You have to have something that's evolved and organic. But on the other hand, it has to be real and not just rhetorical, because we're pretty fond of kind of rhetorical regulation in Canada. We need to avoid that. So I think this is the way. This is respectful of provincial jurisdiction, in that it's, each province will have their own regulator. The regulators will have representation, for example, from families, from seniors, from experts, maybe people who have been part of the industry but now no longer, have no ties. So you'll have this sort of expertise to regulate, to take in evidence, to report. These provincial regulators would be required to report not only to their own provincial government, but very importantly to the public and to the federal government. Right, so we need this transparency of what is really going on across the country at all levels of government, and importantly to the public. Okay, so and I think as well, another important piece of this is that to make sure that the regulator stays robust and, provinces who don't like this idea kind of come along and sort of hollow it out, that the feds actually just pay directly for the regulator, that the regulator has a sort of set amount of money to do its operations, and that happens through that. And in addition, that the federal government create kind of an aged care ombudsman to whom people, families, patients can make complaints. And so there is this sort of canary in the coal mine kind of idea where the federal government, at least at the national level, will be hearing about concerns and can follow them up then with provincial regulators. So that is at the heart of what I think could be a solution for us in Canada to try to work this through. I think, what you will see is there'll be a desire to avoid such a big bang solution as I'm discussing. And I think other possibilities, though, will not do what we want. So, new Fed-Prov agreements. So we saw this in recent iterations of funding coming from the federal government. Agreements written between the federal government and specific provinces. Not enough transparency, not enough teeth. We don't know what's actually happened, for example, with investments in home care. That is not good enough. We need specific legislation because of all those isms that I talked about, right? Ageism, sexism, and a bias against people living with disabilities. The natural tendency of the politics of this will be to drift away from providing the investments in the care for people. Now, there are other things the feds could think about doing because it's a three-pronged thing that we really need. I've only really spoken about the long-term care formal piece, but they could also have more policies to help the adverse effects on informal care providers, such as I mentioned, kind of better social security benefits, care leave, and these kinds of things. And another possibility that we've just been doing some work on that you might like to look at is this idea of actually paying cash benefits to people who need home care, and that allows them to pay for their family members or friends to provide care to them, or retrofit their house if they want to, so that they can live at home for longer periods of time. So this is a very popular initiative in a number of jurisdictions, and we just did a paper with the Institute for Research and Public Policy on that. So that's another possibility, but the main focus should be, I think, on this idea of big bang reform, the new kind of Canadian Long-Term Care Act, or the new Canadian care for people who are aging. There is a window of opportunity because of COVID. So many horrible things have happened with COVID. There are some silver linings, and this may be one of them, right? That there is this window of opportunity to really try to galvanize some change. The political tendency will be to figure out some soft option, right? Some new accords between federal and provincial governments, or the work that they're doing now on accreditation standards. It's not that those aren't important, those are all important, but they won't galvanize real long-lasting and persisting change to protect vulnerable people over time. So big bang change is needed. Let's grab it. And I'll just leave you with a quote about why caring for others should be a central concern for human life. This is by John Tronto. And, it's time that we began to change our political and social institutions to reflect this truth. So I'll leave it there, Sayward, and I look forward to entertaining some of your questions.
Thanks so much for that, Colleen. I think we've had such an in-depth review, but I think it's only scratched the surface of the issue and all of the different silos that sort of need to be brought together as far as solutions go to really get at how complex this is. I'd like to start with a question that we hear frequently, and it's one that's popular in our Q&A. I think we have about 72 questions there so far, so it's very action-packed day to day. But that's this. We're seeing a lot of action and campaigns that are calling for long-term care to be fixed, of course. Some of them are calling for long-term care or for some providers to be made public. Will making long-term care public resolve the issues we've seen build up in this sector over the past decades, and particularly over the last 13 plus months.
Yeah. So this is when they say public, what they mean is, do we get rid of for-profit provision? So in some provinces, Ontario, for example, we have a lot of for-profit providers in the long-term care sector. And as I mentioned, that's where we've seen a lot of the deaths from COVID. More deaths than in the not-for-profit sector or the public sector have been in this for-profit setting. And as I mentioned, some of the issues there have been around how they staff long-term care settings, failure to pay sick pay, and all of these kinds of things. So will getting rid of for-profit providers solve the problem of long-term care? The answer to that is no. Just that one thing will not fix long-term care. It may be part of the solution, but you know, in and of itself, it won't solve the problem, because as I've tried to show, what we need is a huge amount of investment, given where we're at, into long-term care, full stop. Then we can ask the question, how do we best deliver it? Do we want to rely on public or not-for-profit or for-profit? And I think a reasonable call would be to say, well, look, you know, for-profit is really complicated to regulate because they have incentives to make profit, and potentially at the expense of the quality of care that's delivered to patients. So it may be that a particular provincial government or provincial regulator would say, well, look, over time, we want to actually, you know, move away from for-profit care. We don't think that that's the best bang for our buck. And so we will, you know, over time, try to get rid of for-profit delivery and favor not-for-profit care and public care. But I just think you have to be quite careful of thinking that that alone is going to solve the problem, because it won't. You know, we saw this particular issue in the context of COVID, but that doesn't mean that if you just solve that, then, you know, hey presto, you're going to have terrific, high quality long-term care in Canada from coast to coast. It's a more complex problem than that. Does that answer your question? Help answer, Sayward?
I think it does. It's, you know, and that's such a layered question as well to get into, because there's a lot of ideology behind that is really personal to most folks that are involved in the debate or in the issue, or in how they envision healthcare delivery for Canada. So it's,
yeah. Can I just say though, you know, there's a difference between funding and delivery. So we have publicly funded long-term care that has different names in different provinces, right? So in Ontario, we talk about nursing homes. In other provinces, different names for these things. And then we have privately financed long-term care, which are in Ontario, they come in the form of retirement homes. So one thing that we have to think about with this, with any regulator that I envisage, would be how do we determine access to the publicly funded program, right? How do you determine medical need such that you should be entitled to publicly funded long-term care assistance? So that will be another really important piece of what they do, the accessibility to the publicly funded part. But a really important component here is that we will always have a privately financed piece as well, right? Unlike public Medicare, we will always have privately financed retirement homes or assisted living, all these kinds of options for people who don't need, you know, what I would say the full Monty, right? You don't need 24/7 care. You might need some kind of assisted living. But these spaces too need to be appropriately regulated. Yeah, you don't just sort of shut your eyes and say that's private, so, you know, knock yourself out, guys, caveat emptor. We need to have appropriate regulation for both the publicly funded part and the privately financed part. And that's why in my proposal here, I've said that that's the job of this regulator, that they look after both parts, not just the public part. And then in terms of the delivery of the publicly funded part, then we have to ask the question, are we going to try to weed out not-for-profits? And I think my sort of sense of this is that we should leave that to the different provincial regulators. And that, you know, if it was me, I would probably move away from them if I couldn't regulate them, because they're tricky to regulate.
Right. Right. I'll move to a question from, I believe the name is Jurek Romanich, who asks, were there examples of successful long-term care during COVID that you're aware of, and what might have distinguished them?
Okay, so during COVID, we saw better performance, it is true, from publicly funded and not-for-profit homes than for-profit homes. So that's the first thing to take away from this. But again, when you look at why that was because of really how they dealt with staffing questions, and because of some of these older facilities run by for-profit homes also have a lot of people in each room, and as the science has kind of built up about COVID, we know that it's airborne, rather than droplets. So, all the hand washing we were doing early on wasn't as important as we now know ventilation to be, for example, and crowding. So we had that issue with for-profit providers. So that's the first thing. Then in terms of COVID, we did see, for example, some municipalities, for example, Kingston's public health officer did an excellent job there of curtailing the spread of COVID inside the Kingston long-term care homes by putting in place quickly a series of infection control and other means to stop the spread, to stop workers going from long-term care home to long-term care home, and other measures. So we do have some shining examples of particular places where they did all the right thing and they did actually stop the COVID carnage. So, we had the tools there, they just weren't always used. And I think, a really important question is why, after we saw that great example from Kingston, why wasn't that quickly kind of scaled up everywhere across not only Ontario, but, the whole country? I think that's a really important question that we have to ask ourselves, because this whole idea about, federalism and devolution of responsibility to smaller levels of government is that you have this idea, well, we'll see great examples and then we can all do it. Well, we saw this great example and we all didn't do it. So, at some point we're going to have to unpack why that is. And it probably comes back to all those isms that we discussed before.
And I've seen that happen in certain other aspects of healthcare, delivery and access to healthcare, in terms of things that happen in smaller communities, for example, that are really good use of resources. I think there were some paramedics prior to COVID that were doing some home care visits and wellness checks and that kind of thing. And they were successful programs, but never really got scaled up. Do you think there's a way for Canada to, and maybe more specifically across provinces, is there currently a mechanism, or is something new needed to make sure those shining examples get scaled up and shared quicker?
Yeah. Well, there's always this joke about Canada that, we're the land of pilot projects, and
yes, seems that way.
And we have these successful pilot projects. I can think, for example, my dear friend Cy Frank did this fantastic project about wait times in Alberta, and showed how you could manage wrestle wait times to the ground. And yet that hasn't been scaled up and spread because there are a lot of resistance and, barriers to change often. So that's, I think this issue then of, I kind of come back to the governance and of it is really at the heart of what we need to focus on going forward. And as I said, all the incentives will be to sort of drift and do very little, and to sort of weasel around it, sorry to use that word, but to sort of, try to figure out how to do something that will kind of appease people and, but not really change anything. So that's why I'm arguing for this really quite big bang reform of new federal legislation protecting long-term care, which will ring fence funding for it, just as we have for public Medicare, but then trying to give more content than has ever been the case with the Canada Health Act to the criteria, right? So the criteria, for example, of accessibility in the Canada Health Act, you would think that reasonable accessibility would mean that you wouldn't have to wait for a very long time, or months or years, for your surgery, but there's nobody who's really accountable for that criteria of accessibility, right? So it
Mhm.
gets lost in the wash. So that's why with this idea of that the federal government will require, as part of this new Canada Long-Term Care Act, that the provinces set up these arm's length regulators. These arm's length regulators then will have kind of accountability to the public, to the provincial governments, to the federal government for delivering the best they can in terms of evidence-based regulation of the sector, be able to evolve and change over time, to hear from people. I think that would be a real game changer. So in a way, then, if you have high quality evidence about how to improve long-term care, for example, around infection control or paramedics in the community or whatever it is, there's an opportunity for that to be scaled up because you have this body that is actually accountable for that. If you have a problem with long-term care, where do you go? Do you go to the feds? Do you go to the provinces? Do you go to the municipality? Do you talk to your long-term care? Who do you talk to? Well, now you would have one body who is responsible, right? That's where you go. And I think that would be a game changer.
Mhm. And there's that independence factor as well, where there's no interference from industry. That's nice to have.
Yeah. Well, industry, and I would
yeah.
say government itself,
Yeah.
and I know that would be quite controversial for a lot of people, but I think it does need to be independent of government. It needs to be arm's length, independent of industry and government in order to be able to do a good job. Government's job here will be to say, look, we've got X amount of dollars per year to spend on long-term care. Get on with it. Here's your money, regulator. Do the best you can with this funding. And then we can decide if we like what the government is doing in terms of allocation of resources. But the actual meat on the bones and how things will work and how it will be regulated and monitoring long-term care facilities, public and private, would be the job of these new provincial regulators, one for each province.
Just along those lines, and then I'd like to switch gears a little bit to talk about the home care factor in this, because that's sort of some of the upstream that happens. There's a question from Suzanne Bélanger-Fontaine, who is curious about enforcement of national standards. So I know you've talked about standards or solutions that are calibrated to populations. There's so much variability in what populations look like across Canada. Even within provinces and region to region. But how would we go about seeing, or what would you envision us seeing in terms of enforcement of those standards? What would that look like for federal, provincial, different orders of government?
So I think that's an excellent question, because that's at the heart of the problem with the Canada Health Act. There pretty much is no enforcement of the standards, except for the extra billing one, where under the legislation, the federal government has to withhold funding from provinces that permit extra billing. But other criteria, for example, accessibility, reasonable accessibility, so problems with wait times or not being able to find a family doctor and all these sorts of things, these obviously go to questions of reasonable accessibility. But the federal government has never, withheld funding from a province that doesn't deliver on that aspect of accessibility to its population. Okay, so you have sort of a hollowing out of these criteria. So that's why I am saying that the federal government's what it's going to enforce vis-a-vis the provincial government is that the provincial government create an arm's length regulator along the lines that I'm saying. That's it.
Okay.
Right? And that the regulator will have to speak to these standards, right? So the regulator will come up with the standards themselves, and the federal government will not give funding to any province that doesn't do that. That's pretty straightforward, because you can't get, too much into the weeds here, because each province will have their own particular needs. Some provinces have younger populations, some have older populations, some have more for-profit and provision, some don't. This may change over time with the politics of different provincial governments, and you have to be respectful of provincial jurisdiction. On the other hand, if the feds are putting money in, I think we as Canadians say, well, we need to see change, right? We want to see improvement. Otherwise, what's the point? You know, we might as well spend it on something else.
Mhm.
Let's see change, let's see improvement. I think that's the way to go. But it's an excellent question because it goes to the heart of the governance problem here.
Yeah,
Does that answer the question, Sayward? I hope.
I think so. I think we might hear a little bit more about national standards and enforcement as we keep talking.
Sure.
But I wanted to ask about home care because that's sort of the upstream factor to some of this as well. We know older Canadians want to age at home and in their communities, but that more supports are required. And there's a significant gap in Canada for home care services. Are there international examples or examples here at home in Canada that we could look to get things started for, you know, to meet that need or to focus that investment?
Right. And again, that's an excellent question. So the legislation that I'm putting forward here is really about formal long-term care services, and it doesn't speak to the issues of home care and other things. From a provincial perspective, as I've mentioned, there are three important things that have to happen. We have to improve accessibility and standards and quality inside formal long-term care settings, publicly and privately financed. They all have to improve. So this is nursing homes and retirement homes. We need that. We need to invest in formal home care. So that is paid professionals coming to people to help them with their home care needs. And then we need to support informal home care. So, you know, the friends and kids and other family members, the wives, and sometimes the husbands that are providing care to their aging partner, they need support, right, to do a better job. So we do need, we need to make these investments in home care. This, what I'm proposing here doesn't speak to that. We would have to think about that. I think, you know, perhaps that could be brought into these kind of ideas of the regulator, but we need to make those investments in formal home care as well, and appropriately trained professionals. You know, it's a really complicated sort of intersection of need between informal provision of home care, formal provision of home care, and long-term care. And investments need to be made across the board. So what would be terrific is for each province to really have, you know, a set of interlocking proposals that sort of build around this kind of central federal platform of funding for the formal long-term care, and intersect that appropriately with home care, formal home care, and informal provision of care. What I see is worrisome to me is that provincial governments focus on home care. They say, well, we want to put more focus on home care. Nobody wants to, you know, reside in long-term care settings. We're going to shift our resources from formal provision of care to home care, but usually what they mean there is really a lot of informal care. So a lot of, you know, placing the burden back on families. And you can understand why they might want to do that from a cost saving perspective, and particularly when that leads with all that we're saying around, we all want to age at home. But let me remind you that a certain percentage of us will always need formal long-term care services, right? Some of us, not all of us, but some of us will need 24/7 care, right? Because we wind up with Alzheimer's, and it is too much, and it's not economic to expect or provide formal home care 24/7 around the clock, right? That's just not going to work. Or to expect, I think, although, you know, some people may want to do this, to expect your family to be able to do that, because that's a huge burden on everyone around you, right? So, and so what you're seeing now, I think, is that a lot of people are so worried about the quality of care in formal long-term care settings that they're busily saving away so that they can provide for themselves the possibility, this relatively small possibility, that they will need 24/7 care. They can provide that for themselves at home. Right? And that is actually, from an economic perspective, a very ineffective use of resources, because it's only a relatively small percentage of us that actually need that formal long-term care, right? It's an insurable risk, if in other words. So if we can provide this one part and get this done well, the formal long-term care services, I think these other pieces will start to sort of work themselves out a bit more, right? We won't need to all be furiously saving, expecting that we might have to pay out of pocket for our formal home care services, or, I don't know, thoroughly vetting future son-in-laws to make sure that they're going to be the ones who'll provide, care to us as we age, these sorts of things, because we will know that in the relatively small chance that we need that 24/7 care, that is there and it's well provided for. Now, I mean, there are numbers of jurisdictions around the world where you see very interesting approaches to the delivery of home care. In Denmark, and for example, is sort of often held up as, very high quality home care system. So we can learn from other places about how they do it. And as I mentioned before, another possibility, not without its downside, but another possibility is this idea of cash payments to families to help them provide for their own home care needs, and they could then spend that money on supporting friends and family to help them provide care. So there are really interesting models around kind of the mix of formal and informal home care provision that are out there. I'm sorry, that was probably a very long and rambly answer, so I didn't do very well on answering that question.
No, it actually got us to a good place, I think. So Patricia Sullivan-Taylor asks, or notes that you spoke to changes on the inputs and existing long-term care structures in determining quality. But why not also reform the institutional design that we have used to house seniors in? She notes a focus on introducing care delivery in smaller home-like settings, and gives Spain and the Netherlands as an example.
Right.
Is there a thought to go into the design piece at all in this? Is there a place for that in this conversation?
Well, again, I think we can learn a lot from different jurisdictions, and I'm a great believer in fossicking around internationally for the best evidence on what on what to do in terms of the provision of high quality long-term care and home care. So we should look to these other places, and we should rigorously evaluate that evidence and figure out, is this a good way? Is this relevant to the Canadian context? Because you can't just say, oh, well, this happens in Denmark, so we can pop it over into Ontario and Bob's your uncle. We have a different context, different Fed-Prov relationships, different laws, all these kinds of things. So you have to think about that. But that would be, in my view, the job of these provincial regulators funded by the federal government to provide and ensure, the best evidence-based regulation of the sector. And so you're right, I think like looking at different models of provision of care, whether you prefer sort of a focus on these large kind of corporate chains, or it's better to have sort of smaller provision of care. I think these are all things that a regulator in these areas could evaluate and look at. But I don't think that that's the kind of thing that you would elevate to a national standard necessarily, because I'm not sure that you have that, first of all, that in 20 years time that you wouldn't want to be doing something else. So you always got to be careful about setting down in stone a standard that doesn't really hold its water over time and space. And that the kind of thing that we should be focusing on as a national standard is, as I said, to really ensure the kind of governance part, the transparency part, the accountability part. And I think if you do that, the other pieces will come together.
So ensure provinces are regulating effectively and establishing the standards that providers have to hold themselves to.
Right.
Yeah,
because, when we established the Canada Health Act 50 years ago, You know, and it's you know, served us pretty well, but it really is something that, you know, it's focused on physicians and hospitals, for example. That's awesome, but you know, I think we all agree that other aspects of healthcare are super important, more important, far more important than they were 50 or 60 years ago, like prescription drugs and home care and long-term care, but that's not part of the standards. And so, you know, we set it in stone, and it's really hard to change it now. So we need to make sure that we put in place a standard that is meaningful over time and space, if that makes sense.
With the flexibility to evolve with the changing
Me,
reality of demographics and what life
exactly.
looks like. I guess that's part of, or something that layers into the conversation, or people who have questions about, you know, hindsight being 2020.
Yeah.
Was it amiss to not have included things like long-term care or pharmacare? That's a whole other conversation. But was it amiss to not include long-term care before now under the Canada Health Act? What would you say about that?
Yeah, I mean, I think the Canada Health Act is a beautiful thing in so many ways. And it's obviously a template for what I'm proposing here.
Mhm.
'Cause it is a way for the federal government to get funding out to provinces and to try to raise all the boats to a certain level, right? From coast to coast, as they say. So there are a lot of good things about it. However, one of the bad things about it was the question that came before around enforcement. You
Mhm.
know, there's really very little thought about that. Also, the fact that the federal contribution diminished over time, and so the politics of the Canada Health Act kind of superseded what was written on the paper. So, you know, we have to think about how to avoid all those problems when we design something new. So, you know, if you just put long-term care under the Canada Health Act, I don't think it fits there very well, because we need, uh, with um, with provision of care for an aging population, we need to think about regulation of both privately financed and publicly funded care.
Mhm.
There's not the same dynamics as in public Medicare of wanting to have, you know, one single public payer. There is a blur here between sort of a progression of our needs from, you know, we don't need too much assistance to when we need sort of 24/7 assistance, but both need to be appropriately regulated, and both sets of institutions. And then we also need the kind of accompanying home care and the informal care. So I think the particularity of long-term care means that it's not a neat fit for the Canada Health Act.
Mhm.
Um, but should we have done something about long-term care before now? Well, I think yes, we should have. We
Mhm.
all should have. And that's a societal issue, and it goes back to those problems I mentioned of ageism and sexism and, you know, prejudices against people, particularly living with mental disabilities. I think we're all terrified of that being us, and we prefer to put our head in the sand and
Put
ignore
it
the
out of
problem.
our, yeah, out of
So
our field of vision. Yeah.
it's out of our field of vision, and we need to remember that that will be the strong kind of push on the politics of it. You know, once COVID is over, there's going to be a drift away from this. There's a window of opportunity now. You know, the Prime Minister has said he wants to do something in this space. Let's make sure that what they do is actually really meaningful, because otherwise, don't bother.
Right. So, conscious of time, there are a few things I wanted to touch on before we wrap up. And I'm so sorry that we can't get to all of the questions, or that we don't have more time with you, because I think we could spend many more hours talking about this. But one thing we hear a lot about is jurisdiction, and you covered that on your slides. So that's one challenge in establishing that national standards. But I think the framework you're contemplating is more about establishing the governance mechanism, or the system to ensure there is adequate regulation. But some premiers are supportive of coming to some kind of solution, while others have expressed opposition
Yeah.
in no uncertain terms. What impact will this have, and what would your advice be in terms of navigating the jurisdictional dynamics in Canada?
Yeah, yeah. Well, I think the jurisdictional dynamics are important, and obviously, I think about that a lot, and how to sort of have the best of what we have in Canada, which is the diversity of Canadians from coast to coast, and our different provincial capacities. So that's something that we really have to think about. And I think some of the opposition you might see from a province relates to what I said before. Look, we've heard this before. You're going to give us money, and then you're going to expect X or Y or Z, and then you're not really going to be around in 15 years while we're still holding the can. So that has to be addressed. There has to be basically, enshrined in the legislation, sort of a funding mechanism that the provinces know for sure that in 15 or 20 years, the feds will still be at the table with their share of the dollars. So that's a really important part. The second important part is, a lot of healthcare is politicized, and there's a lot of Fed bravado on this or that or the other. But generally, I think if you put money on the table, most people will come. If it's enough money, the provinces will come. If it's respectful enough of their capacities and jurisdiction and so forth. And so I think this really is a question of federal leadership. The Canada Health Act, for example, wasn't welcomed by everyone. There was a lot of opposition from different provinces, but the feds led and they put it in place. And over time, it's kind of become an icon of Canadian life. So there is this window of opportunity for the federal government to do something really momentous and important here to help people as they're aging, but still be respectful of provincial jurisdiction. I think they just need to look at the dynamics of what went wrong with the Canada Health Act over time to figure out how to speak to the provinces. And I think you will see the premiers of some provinces where there is a lot of for-profit care, and who may be worried that the national standard will be get rid of for-profit care. And that might explain their opposition in part because of the constituencies that they want to speak to. And again, I think that could be dealt with through the regulator being set up, and over time that evidence-based regulator will look at the evidence about for-profit and not-for-profit, figure out if they can regulate those for-profit providers and deliver on that high quality care. And that will be, I think, a way around this problem for the feds and the provinces. So totally, this is the question, I think, how we deal with this jurisdictional issue. But just dealing with the jurisdictional issue isn't the policy goal, right? The policy goal has got to be improving long-term care. So we have to take that into account, but then we have to figure out how do we actually move those goalposts forward really, so that we deliver high quality long-term care to the people that need it at the end of their lives as they're aging.
And I think the way you characterize that in another conversation we had with you was making sure it serves the public interest at the end of the day.
Exactly. So that these regulators are not about kowtowing or keeping all the federal and provincial governments happy or the industry
Rubber
happy.
stamping,
Their duty is to the public interest, right? That's who it should be to. And that's, we obviously hope that our government's duty is to the public interest too. But I think, creating more of a direct line of accountability between a provincial regulator and the public that they serve, that's the way to go.
Harry Singh asks, and there was another question along the lines of this, but what role do you see for organizations like federal retirees or individuals who hold this topic close to their heart to really galvanize governments, politicians of all stripes to get on with it and work with the moment that we have?
Yeah. Well, I really think that, these kinds of meetings that you guys are holding are essential and critical. Write to your MP and at both the federal and provincial levels and say what needs to happen. I think there is a window of opportunity here, and you need to kick the doors in, and be careful of the soft solutions that they will try to peddle. It's inevitable. be careful of those don't buy into them. We need big bang reform here to really change the future trajectory of long-term care for Canadians. I think what would be good, I've laid out governance options here, and I know that these may not be perfect, and but I think this is the kind of discussion and debate that we need to have, not about whether we'll do it, but more how we'll do it.
Mhm.
That would be great if we could move to the how, and perhaps develop different legislative options to consider. So actually draft up some draft legislation to debate and discuss, and perhaps even try to get the Liberal government to bring it forward, or if not, other parties to bring it forward for consideration by the House. So I think that's what we need to do. So
Excellent.
not if, but how.
I think that's where we're at. I think we've heard from MPs that we've met with. There's violent agreement that we need to do something. It's the what. I think that we need to move ahead with, and it's conversations like this that will hopefully help that.
Yeah.
Last question, I promise. There's a big moment coming up over here on Monday with the federal budget coming. And the federal government's talked a lot about setting up national standards, spoke to that in the throne speech and in other places. Do you think, all the way from New Zealand, we'll see anything about that in this budget? Or is there one hope that you have for the budget on this subject that you'd like to see Monday?
Well, what I would like to see is a very big envelope of funding for long-term care, with how that will be delivered on still to come, I think. So that would be my hope. What I would be very disappointed in is that if this is just about setting some standards, not vague, but standards for private companies, public and private, to sort of sign on to through accreditation, through voluntary accreditation. It's not that that's not important, and that's a helpful thing to do, but it's not going to get the kind of big bang change that we need. And I just
systemic change.
Yeah, this will just be sort of soft pedal, not very much, and sort of a rhetorical flourish. Look, we've done something about national standards. That's not good enough. We have to have significant investments into long-term care. This needs appropriate regulation over time and space. We need big bang reform here, not small reform.
It's time.
Yeah.
Colleen, all of our thanks for sharing your time with us and this outlook today. I think what we've heard gives many of us some hope that the tragedies and there's no other way to characterize it, that the tragedies that we've seen unfold in long-term care during this pandemic don't have to ever happen again. But it does mean that the advocacy of organizations like federal retirees and our members are more important than ever in pushing elected officials across all levels of government to do the right thing. And that's to come together and do what's needed to fix long-term care. This issue can and should define our next federal election. As you said, there is a moment here, and we can't afford to let it pass by. It's clear we'll need a stronger team than ever before to have an impact in 2021 and during the election, whenever that may be. So to folks who are listening today, if you'd like to be part of the federal retirees advocacy movement, please join Reach 338, our nationwide network of advocates working together to advance our mission to improve the quality and security of retirement for our members and all Canadians. Reach 338 is a great way to influence the priorities of our next government, and you can find a link to join Reach 338 on our website at federalretirees.ca. I'll also mention that we have a Right to Your Elected Official campaign running on long-term care and establishing standards and a framework with funding and teeth. So if you haven't yet, please take the time to surf over to that on our website and be sure to connect with your MP to make sure they know that you're on this as a priority. Thanks again, Colleen, from University of Ottawa, Centre for Health Law, Policy and Ethics. It's been such an honor to host you today and to hear from you.
My
I'd like
pleasure.
to thank our staff team, especially Jessica Searson, Joanne Miron, Patrick Imbeau, Amy Baldry, Jean-Sébastien Coutet, Gabrielle Lavoie, our interpreter Pauline, and the many other colleagues who make these events happen. And thanks to our members and other folks in the audience for taking the time to join us. I'll wrap up with the words of one of our leading public health officials during the COVID-19 pandemic. Dr. Bonnie Henry encouraged each of you to continue to be kind, be calm, take care of each other, and stay safe. And for our Eastern Canadians, per Dr. Fitzgerald, to hold fast. Enjoy the rest of your day.